Welcome to our continuing series of virtual voices focusing on the United Nations Sustainable Development Goals. Today, we are very pleased to welcome Dr. Pavlo Zamostian, who is Assistant Representative of the United Nations Population Fund in Kyiv. He is a research professional with several years of experience in public policy, program management, and emergency response. Dr. Zamostian has extensive experience in community-based economics and disaster risk reductions, with emphasis on design, implementation, monitoring, and evaluation for projects related to water, sanitation, hygiene, health, nutrition, and livelihood. Over to you, Dr. Zamostian.
Thank you, Dr. Durbach. I'm really pleased to be part of this series of webinars, and good afternoon, good morning, I don't know where, good evening, where our colleagues who joined today now participating. And I see a lot of Ukrainian names, but as we agreed, I will make my presentation in English. However, of course, as I'm Ukrainian, I can speak in Ukrainian afterwards. Let me start sharing the screen. And go to my presentation. I hope you see it, right?
Yes, it's very clear.
Today we will talk about prevention and response to sexual and gender-based violence in Ukraine and those challenges created by Russian aggression, by the war. As UNFPA, we are the lead agencies across the world to work on the issues of gender-based violence, and particularly sexual violence, including in the cases of the war. UNFPA, as a global organization, we aim to 3 zeros, and one of the zeros by 2030 is exactly zero gender-based violence and other harmful practices. The other two are about zero maternal deaths and zero unmet need for family planning. Very much related issues of sexual and reproductive health. Nevertheless, we talk about gender-based violence today. What I'm going to try to cover today, first of all, we need to understand definitions. Yeah? We need to look where we were in Ukraine before the war, what has been done, what has been achieved, and how the war interrupted our progress towards Ukraine free of gender-based violence. The war, a new reality, what happened, what is UNFPA doing now, what is our response to this challenge, how we're working with our partners on the ground, and we are in Ukraine. I want to specifically highlight that UNFPA and its staff never left Ukraine. Some of our colleagues left, and work remotely. But as an organization, and including its senior management, including myself, we never left Ukraine. And we, from the very first hours, we were working in Ukraine and for Ukraine to help people in need. What are our plans and needs? And of course, I will be happy to answer your questions. I hope there will be a lot of questions, yeah, as the issue is definitely now in the news and in the media reports, and quite challenging and sometimes even confusing. Well, first, so as I said, let's start from definitions. So we talk about gender-based violence, and it's there are a number of say definitions, but in general, we understand that this is harmful acts directed to an individual and based on their gender. And experts highlight that this is not about just, I mean, the physical, men, women. It's about gender, as acts of gender-based violence could be committed against LGBTI people, and that means that gender identity is an important parameter. Yeah, if we talk about gender-based violence, we know also that vast majority of acts of gender-based violence are committed against women and girls. That's statistics. 80–90% usually. We also know that every third woman in the world was affected by gender-based violence throughout her life. Every third. And so this is a crime which is known in the whole world. It's not a problem of a particular country or countries in the world. It's affect all strains of society, poor, rich. It doesn't matter. Of course, there is the groups which are at higher risks, but it happens everywhere and could happen with everyone. Usually, we distinguish between several forms: physical violence, verbal hate speeches, psychological violence connected to verbal, sexual violence, and economic violence. These are different forms, and it is clear that physical means it usually involves any forms of physical effect on survivor, beating, etc. A lot of majority of cases which we're observing in Ukraine before the war were psychological violence, which could be equally, painful as a physical one. We also need to distinguish, which is part of concept of gender-based violence, domestic or intimate partner violence, and particularly Council of Europe Istanbul Convention looking into this form of crime as acts of physical, sexual, psychological, and economic violence occurring within the family. So within the intimate partners, yeah, that's the only kind of distinguishing factor. Although the root causes are more or less the same, the root causes of gender-based violence are in gender inequality, particularly inequality in incomes, in economic situation, in the access to income, and in most of cases, this inequality and lack of economic independence is an important driving force for intimate partner violence. Another form is sexual harassment, which is usually associated with the non-domestic environment, which could happen everywhere except at home between the intimate partners. It could happen at work, in the transport, on the street. And you see on the slide I put here the definition as per Istanbul Convention. More or less other sources provide the similar definition. This is also terrible violation of human rights and and damaging and all quite offensive, I mean, to women, girls. It could happen also with men, and of course with LGBTI people, you know. But it covers by a separate legislation and a separate measures. Well, and of course, you know, United States are known for a number of campaigns in the media and involving the the actors, you know, this film industry, including, by the way, one of the you know, famous actor who is a goodwill ambassador of UNFPA in the world. But although conflict-related sexual violence is a form of gender-based violence, it has a significant difference compared with the, for instance, domestic violence or other formats of GBV, because this is basically a war crime, and it's committed purposefully, forcefully, by and during by those involved in armed conflicts, and has direct relation to the armed conflict and happening in the area of armed conflict. Usually it's also referred as a war crime, and thus requires a special measures of investigation, and it's also subject to a certain legal procedures, including monetary compensations to survivors. Of course, conflict-related sexual violence happening in all conflicts around the globe. It's not unique to Ukraine or to Africa or other settings. It's happening everywhere, and it's similarly very difficult to find the truth, to identify survivors and link them to support. And it's also equally difficult to, let's say, achieve justice in the conflict-related sexual violence, because the issue is, of course, related to the big politics, to involving different countries and different, you know, actors at the political level. So this issue is probably the most dangerous, the most difficult to deal with, and unfortunately, it also hit Ukraine now with the, I would say, new wave of Russian war, which started more than 8 years ago, right? I must say that there were few cases reported by OHCHR, and so this is an office, you know, UN Office of looking for human rights, UN agency which is investigating human rights violations across the world. This OHCHR, they have a special mandate in Ukraine. They have mission mandated by the United Nations to support proper investigation of human rights violations in Ukraine. They published a report dedicated to conflict-related sexual violence a few years ago, but there were only a few cases, fortunately, I mean, I would say, reported at that time, at the beginning of the war, referred mainly to 2014, 2015, and a bit later, but now, of course, we are facing the big, I would say, outbreak of this phenomenon. I just want to show you a few, you know, I copy-pasted here a few advices related to, you know, conflict-related sexual violence, just to illustrate the peculiarity of this phenomena. And this is do and don't In this case, this is for specialized GBV actors, service providers. And for instance, it is not advisable to seek out individual survivors for reporting, actively do advocacy in the media purposes. The service providers should not attempt to investigate and verify cases. It is not advisable also to establish a separate services, or and not to segregate survivors of conflict-related and other forms of gender-based violence, create parallel structures, and many other recommendations. This is all developed by UN, and we are spreading this across the actors right now to advise. And this is just to illustrate the complexity of the issue and how the issue should be addressed with a lot of mindfulness and very carefully, having in mind the main principle: do not harm, do not do harm, and the survivor-centered approach. To having in mind that survivor should be in the center of our interest, and we should first of all care about her or his, survivor interests of confidentiality, of providing adequate care and support, and then secondary things related to all sorts of investigations and other procedures. And this is the same for media. There were many reports following the Bucha tragedy, and not all of them were actually very correct. There were attempts to trace survivors, even do some media investigations, show pictures, provide details of what has happened. This all happened in relatively small communities, where it is very easy to identify someone based on the story, based on even pictures of the vicinity or other details, and this may harm the survivor who already suffered enormous violence, who already has a huge psychological trauma, and may need a lengthy support to recover. And it may happen or not. This recovery depends on how effective will be and how soon will be provision of support. We are talking to our colleagues in Bosnia, another country in Europe which had experience with the conflict-related sexual violence and the ethnic-based war. And they say that they made a lot of mistakes at the beginning, and even now, almost 30 years or after the war, they still discovering cases. They still find, there are still open eyes information, and they're still dealing with the consequences of the violence itself, and improper response to this by authorities, by humanitarian actors, etc. However, we are not starting from zero ground. UNFPA, with the government, with our CSO, civil society partners, we were working in Ukraine since 2015 to make Ukraine free from gender-based violence. And we were working on the policy side, and Ukraine was very successful, achieved considerable results. We adopted legislation which is almost 100% equal to the meet requirements of the Istanbul Convention. The convention was not ratified due to political reasons mainly, and there were a lot of chances to do that, but nevertheless the legislation now in Ukraine is one of the most progressive in Europe, but also around the world. And government at all levels, especially recently, were demonstrating us, commitment to really move forward with development of the centers for survivors, development network, enhancing police response, providing legal support, many other dimensions. Just before the war last year, government decided to allocate a direct line in the budget, the subsidy to communities, to establish shelters or psychosocial mobile teams, local services for survivors of domestic and gender-based violence. The amount was around 10 million. It's not a big money, from American perspective, but it's a big money in Ukraine, and it's a very, stimulating, demonstrating real commitment. Not a frequent case in our Ukrainian policy, this is how our program was looking like a very comprehensive program. We were working on various strengths, and we were really committed as UNFPA to support Ukraine on its way towards zero violence. It's included services, it's included economic empowerment of survivors, it's included awareness raising. We were supporting the most powerful Break the Circle campaign, which is known now to every third Ukrainian, and many other initiatives, projects. We supported 30 municipalities to build local systems. Unfortunately, many, in the east, here in the east, you see now under heavy fighting or already occupied and ruined, like Mariupol, which was a champion, to say, and Melitopol, and Severodonetsk is now a second Mariupol, However, there were other municipalities. We had this project called Municipalities Free from Domestic Violence. We were very successful in mobilizing mayors' support to work and to help to establish effective system. This was all interrupted by the war. More about services on this map. We helped to establish 21 shelters, crisis rooms, and many other facilities, including, by the way, health facilities, providing anonymous support to those who need assistance in the case of unprotected sex, including violence, by the way. We were providing special reproductive health kits, which contain everything necessary to treat to provide clinical management of rape. This is a term. Again, a lot of efforts were in the east, and many of these facilities already not functioning. This is a map as of March, and now you see it's Mariupol already under occupation, unfortunately. But we believe it's temporary. We will come back. We will rebuild the communities, municipalities, towns, and villages, and also restore the system. This is our belief, and this is why we are working. There were recently several steps made by the government. Just a few days ago, our famous ambassador Sergei Kislitsa, ambassador of Ukraine to the UN, at the special meeting of the Security Council, which was specifically looking at the conflict-related sexual violence, he made a very powerful statement. He's known for his powerful statements, but in particular, he mentioned that Ukrainian law enforcement and NGOs, media, recording numerous cases of sexual violence committed by Russian troops in Ukraine. And these are all coming from all the regions which were affected by occupation. There were different people affected. There were children, there were girls, there were women, there were elderly, there were women and men, boys and girls. And all those people were victims of Russian rapists, unfortunately. And there were also fatalities reported. At this picture, you see Vice Prime Minister of Ukraine, Olga Stefanishyna, signing the memorandum with Her Excellency Pramila Patten, the Special Envoy of the Secretary General on the issues of conflict-related sexual violence. On another picture, you see a mobile team of police. It's a mobile group, and there is also a psychologist who joined the group from Kyiv Gender Equality Center. This is facility also supported by UNFPA. This is not an investigation group. They're going to the settlements in Ukraine, in Kyiv region, in Sumy and Chernihiv, talking to people, providing information that sexual violence is a war crime, that the people may receive support, that they should looking for support and care and not to stay alone with this phenomenon, with this tragedy, with this what happened with them. And they are quite successful. Just a few days ago, they referred a girl from Sumy region, I think, or no, from Chernihiv region, and she's now with the support of psychologists working individually with the girl who were affected. They also identify several other cases, but the issue is that we have to say that honestly, we don't know where are the survivors. This is the most challenging task, is to identify or find them and link to support. There were media reports, there were, everybody were talking and everybody continued to talking about this, but a few people knows where there are victims, where there are survivors now. And how to make this miracle, to connect them with an individual, anonymous survivor center support, at least psychologists, psychotherapists who can individually work with them to support their recovery. And later, the person may be willing to engage in investigation, but this should be absolutely her or his will to report the case to the law enforcement. Yeah. We, as UNFPA, have developed our response plan. We are working on many directions now, but mainly our first line of support was to establish outreach mobile teams. This, I will show you the map later, just in a second. And this is, to a certain extent, we are coming back to 2015. At that time, we recognized that we need to provide support to survivors where they are. We need to create a trust. We need to send specialist service providers to the people, to the affected people, not ask them to come, but rather outreach to them. And we created this model of psychosocial mobile team, or mobile clinics, if you want. It's a small team of 2 or 3 people, social worker and practical psychologist, who have phone numbers, which we advertise, of course, and who can be approached by survivors by calling them, or they proactively go to the villages, talk to people, offer their support. This model was so successful back in, a few years ago, that government decided to actually incorporate this model into national legislation. And before the war, there were already municipalities were establishing such services to help domestic violence survivors. Now we are coming back to that model because we recognize that the municipalities may not have enough resources to sustain services, and we have a new phenomena, this conflict-related sexual violence. So we are relaunching mobile teams with full support of UNFPA. Already 24 teams are working, and we are targeting to launch up to 100 teams across the whole country. We're also supporting safe space solutions of various types for women, shelters, crisis rooms. We enhancing specialized services, and I will tell about few projects a bit later. We're also supporting, the La Strada. It's an NGO, one of the leading NGOs in the area of GBV, La Strada hotline, which can be also a window of support for those who need to call 116123 in Ukraine. There is also a government call center 1547, the phone number. Those facilities also supported by UNFPA to work, particularly La Strada hotline. Since the beginning of the war, they already provide. They provided counseling to more than 1,500 cases, and almost 400 GBV cases were identified and served. So the system is working. La Strada hotline was working before the war. Now they never stopped, by the way, and they continue to work right now. This is an important partner. We also moving ahead with another initiative. So here is location of mobile teams. We prioritized few regions which are bordering with the with the active fighting and occupied, partially occupied territories. We will now launch mobile teams in Sumy and Chernihiv and Kyiv region. This is underway, will be happening in a few days, and other regions. The western regions, of course, are priority since it's a regions where there are a lot of internally displaced people, those who left their homes because of war. Now, the new initiative, this is a platform for long-term psychological support of survivors. We launched it just a few days ago with the catchy name of Aurora, nothing to do with, my age. People may, associate it with something else, but this is an online platform for psychotherapeutic support. You see the address. It's a temporary address. We placed it on our website of the information campaign, but we aim to create a separate online platform for this initiative. And the idea is that once basically the survivor may go online, do a quick registration anonymously. The survivor may use nickname to register. We will not trace. We will not, we don't need their addresses or whatever. And they are linked to psychologists, individual psychologists, psychotherapists, whom we recruited. They are working for us. They are our consultant. And they individually will work with the case, providing support and necessary, psychotherapeutic treatment. We are happy that there are already few cases under treatment. The The platform was raised, the initiative was basically announced only last Wednesday, yeah, a week ago. So you can go to this website and check. There are names of the psychologists, and this initiative we hope will be growing. And essence is that we believe that this initiative, will create a trust for survivors, trust that they will receive necessary help, they will not be followed, they will not be traced by media, they will not be forced by investigators, etc., but they will be supported to recover. So in summary, mobile teams, I said, reinforcement of municipal services in many regions, hotline. What else? Just last week, we were in Dnipro and Zaporizhia, and together with our government partners, now office of Vice Prime Minister Stefanishina, she initiated creation of so-called survivors relief centers, or in Ukrainian it's Центри допомоги врятованим. The idea is that the first such center will be established in Zaporizhia, because this is the frontline city which is still receiving thousands of people who are escaping from the regions which are temporarily occupied. You probably followed on TV the evacuation of the civilians from Azovstal and Mariupol, but there are other territories in Zaporizhia, southern Donetsk, Kherson, and people are still escaping, finding their ways. Even the pathway to free Ukrainian territories is a very risky, and violence, including sexual violence, may happen there. And the idea is that we will establish so-called kind of a front office, which will provide initial psychosocial support, help people to calm down a little bit and, understand that they may receive support. And in case we will identify such potential survivors, they will receive an individual case manager who will work to make a way towards health assistance, legal assistance, economic and social care, and of course, long-term psychological support. It could be on site if people decided, if people decide to stay in Zaporizhia, or on site in other cities where we have service providers, or it could be online. And then the person may decide to go to Poland, Slovakia, to United States, to Canada, and they still will be connected to the individual psychologist working with us on this Aurora initiative. That's why online, online may be not the perfect way of provision of psychological and psychotherapeutic support, we know, especially, but what we can do, I mean, this is the reality. People are moving, and this is better than nothing. And this is also, we hope, a way of creating trust. Needs. Well, first of all, we need experience and knowledge. Although UNFPA is a global organization, we have our in-house experience. We work across the world, and we have experience in many other countries. But the world is dynamic, the knowledge is dynamic, and we may not know some innovative methods, solutions, idea. World is now based on innovations, and we need this experience and knowledge, and we would be happy to receive such support in terms of experience and knowledge.
So,
support to psychologists. I mentioned the psychologists who are working with us in mobile teams, we have psychologists who are working in shelters. All of them need supervisions, training, counseling. Burnout effect is terrible, you know. It is all very, you know, hard work, hard stories. Psychologists are, you know, burning themselves. That's why, you know, supervisions are very important. Of course, training, because you know, this is a crisis psychology, dealing with the trauma, and not all psychologists who are available to work with us have this practical experience. So training and counseling in case of difficult cases is also what we are looking for, and you know, working on this. Innovative solutions, including...
Thank you, Dr. Zamostian.
Yeah, just...
We are very grateful for a very extremely informative presentation on not only the problems of sexual violence worldwide, but specifically what has been happening in Ukraine. We are also very glad that you were able to provide us with some of the survival relief centers that you talked about, and the website where they can get private help without any exposure. So we will turn over now to Susie, who will be asking you the questions that we have received. Susie?
Thank you so much. Before we get started with our Q&A, could you please stop the screen share?
Yeah, I just wanted to show the links, yeah, for a while.
Thank you so much. So our first question here is, there were verified sexual assaults on men during the war, and sometimes people, women or men, may be ashamed to declare the act of rape that was committed on them. Is it more difficult for boys and men to speak up from your experience?
We know from experience in other countries that yes, boys and men usually, you know, for them it's much harder to open up. And this is, yeah, there were, I mentioned that there were a few cases, I mean, reported among civilians, but those Ukrainian soldiers who were, you know, in prisons, in Russian prisons, they came back, a lot of them came back after a very serious, you know, a very heavy, you know, sexual assaults and violence committed against them while in prisons. Yeah, so it will stay with us, as I said, for quite a long of time. And additionally to civilians, at some moment there will be a need to provide support to particularly to men who were defending us, to our defenders. Yeah.
Thank you. So we know about the horrible crimes in the areas under Russian occupation, but there's also a large influx of people moving from the east to the west. And what we're hearing in that situation isn't comforting either. So among the migrants are often suspicious men who will drink alcohol and then molest sleeping girls. What can we do, and how should we react to these kinds of situations?
Exactly. I didn't mention this, but all our services, you know, they are tuned to provide support to all forms of gender-based violence. I mentioned I went to Zaporizhia and Dnipro. We spoke to our colleagues who are working in shelters, and they said we expect a growing number of domestic and other forms of violence happening. Of course, women who are traveling, especially, women they're traveling with their children or alone, especially abroad. They are at huge risk of trafficking and associated sexual or other forms of gender-based violence. So this is another priority. Well, and and indeed it could happen not the occupied territories, but elsewhere in the country, and that's why we are, creating and supporting, enhancing all these systems, which eventually will serve survivors, but also work on prevention, awareness raising, things like that.
Thank you. And do these resources also teach people who are maybe observing situations like this as they're immigrating?
Yeah, absolutely. We, as UNFPA, we doesn't have mandate to work in Poland, in neighboring countries, but we produced quite a number of awareness-raising materials, and we were distributing these materials at the crossing point when there was a big flow, of Ukrainians who were fleeing Ukraine. We were also placing it in the IDP receiving centers, in the trains, etc. Of course, our social media, and not just UNFPA side, but as I said, we have social media of this Break the Circle campaign, so which is much more known compared to our own corporate.
What can we do to simplify the procedure of identifying the act of rape in the police, for example, to help women feel more protected, heard, and not triggered?
The key word is trust. The key word is trust. How to build it? Well, that's a knowledge and experience. For instance, I show you a picture that was a very interesting initiative of police, and there were specialized police. There are specialized police troops in Ukraine established to deal with domestic violence. Now they are working also on this front of conflict-related sexual violence. So first of all, build the trust. So people approach police with the trust that they will receive care and support and not be, taken to investigation and another rape in this form. So trust and quality, quality of services, then this will hopefully attract and kind of encourage people, survivors, to seek help. Otherwise, it's because they are traumatized, they're so traumatized, they're coming out with just one idea: we are alive, so this is good. Everything what happened, it's in the past, we are alive, God save, we are alive. So they are not really recognizing that something bad happened to them, which first of all will require assistance, external assistance, care, and that this is a war crime, which eventually need to be reported and investigated. Yeah.
How do you think we can increase trust and improve the quality of care?
Well, through care, through smart awareness raising, through creating this, centers which will, offer this support openly, through champions. We have our goodwill ambassador, Maria Efrosinina, who will help us, I'm sure. First lady, usually, she's committed to advocates, through advocates who will, send this message.
Agreed. So in Ukraine, for some time, the media actively reported an underage girl who had a baby after being raped by a member of the Russian army. What are your thoughts on the way the media covered this information and gave a public assessment on this girl's personal decision?
In my presentation, I showed a few, an example of advise what media should follow in this case. I believe that media reports are important, but they should be very careful and think about harm, first of all, which they can, do to the survivor, in addition to eventual benefit of, attracting the attention to this war crimes. So there are some common rules which we are trying to spread and work with media colleagues to advise them how to report on the cases of violence.
Excellent. So what barriers do victims have to overcome to access the appropriate care that you've observed in your work?
No, first of all, trauma, their own trauma. This at least initial psychological support should be provided for people in order to start recognizing the issue, recognizing the problem. I think that, again, the lack of trustful help, that people just don't know, and lack of information, they don't know where to seek help, from where to start, and what to expect. They also may be on the move and simply do not, they have other priorities, and they still have to take care about their families or their own future, and that they may create a further barrier, at least to mention.
And what are the types of post-traumatic injuries that can occur in a victim of sexual violence, like more specifically?
Look, I'm not a psychologist, so I would rather leave it to Dr. Durbak to comment. I'm managing programs, so I'm not psychologist. So this is not question. I would rather prefer not to go into these details and not to look like funny, not professional.
Understood. Respect that. And so do you know what percentage of people who suffered from sexual violence have returned to a normal life, like just based on your program management and reporting?
Look, I don't have this figure in my hands right now, but in case of timely provision and adequate support, the chances for success are big. Yeah, and usually, well, it's a big trauma, and but it's curable, and it should be comprehensive. It's not only about psychological assistance. Once the psychological assistance is provided, then the next step is to reintegrate the person in the society in terms of income generation and maybe new job or new place of living. This is not just about, psychological support is important first step, but then there are other, needs which have to be kind of included in the initial plan, and we are in particular looking how we can also support the economic redress of survivors, help them to have incomes and engage in the post-war life more effectively.
Thank you. And in our last few minutes, as we wrap up the Q&A, what are some advice and closing remarks that you'd like to leave the students who have joined our webinar today with?
Well, as a Ukrainian, and now I'm, taking out my UN hat. And first of all, I think we wish all of us the soonest victory. And we believe in our victory and that Ukraine will survive and recover. I think that especially those who are Ukrainians, young Ukrainians, Ukraine will need you Ukraine will need your skills, your talent, your knowledge, your experience. So try to help as much as you can. Third, the values. For us in UN, we believe in human rights and human dignity, in the justice for all. So I believe that all of us need to share these values of humanity and look where we can contribute. It can be very easy. It might happen. Violence, as I said, may happen next to you. You may notice it, and you may act to stop it, to prevent it, or suggest how to seek help to survivor. This is simple, but also very important. Thank you.
Thank you so much. Back to you, Dr. Durbach.
Thank you very much, Susie. Susie, did you ask the question about, could you please tell us about the work of the municipal services in Ukraine? How exactly are they funded and what do they do? This is a question from Ukraine.
Okay. A good question, yeah. Let me take an example of Kyiv. You know, actually in Kyiv, before 2019, there were basically no specialized services, or very fragmented services if we speak about gender-based violence. However, later, with the initiative of Deputy Mayor, she approached us, she approached other, partners and donors, and she declared that they want us to help them to build the best system of response. And within 2 years, jointly with the municipality, we established 2 crisis rooms, a shelter, the Center for Psychological Support, the Gender Equality Center, the Municipal hotline, and basically the system of support to gender-based violence survivors. This is funded by Kyiv. The city council adopted the budgetary program, dedicated budgetary program to support all these services and develop it further. Right now, they experience some financial difficulties, and we will step in to support them, not to crash, not to fail. But this is just an example when committed mayor, deputy mayor, a partnership, and some, catalytic financial support can push things forward very easily, and from zero ground create quite well working system. Yeah, so it's a system of services. It's a short-term crisis room where a survivor can stay. Its police can, assist survivor to go there in night, and she can stay there for 2 weeks. The shelter is more longer-term solution where survivor can stay for 3 months. Mobile teams are outreach facility, hotline or call center. It's an online facility to help online, to provide psychological counseling online. So this works together. This connect the dots, and this is a multi-sectorial, as we call it, referral system at the municipal level.
Susie?
Over.
Thank you. It looks like we have one last question. So now in Ukraine, you can often hear in the media, thanks to the armed forces of Ukraine for the brave fight against the Russian occupiers. But for the most part, they thank only military men and forget about women, who are so many at the front. In your opinion, why is Ukrainian society still not fully aware of the issue of gender equality? And why is this topic of gender equality not as important of a topic for Ukrainian society as any other?
Because Ukrainian society is not perfect. We are still full of gender stereotypes. And before the war, this was an important part of UNFPA work to combat gender stereotypes. We were working also with men, supporting such initiatives as Tato hubs, Dad's hubs, to engage men. But that's true. I mean, in many reports, we mention men, but at the same time, we can't say the situation is very bad. I mean, remember the celebration of the independence just before last August, and there were women marching there. More and more officials properly use feminitives in their speeches, in their writing. More and more, legislation do provide necessary requirements for that. So there was a progress, but it cannot happen overnight. It's a change of mindset. It's a change of the whole mindset, I would say, and this is most difficult to change. It's the same with the corruption, with other things. And we first of all, we should look at ourselves and on our neighbors and our friends and how we kind of consider this. And it should not be also a very theoretical thing. It's a practical thing, also that gender equality is simply a recipe for our resilience, for our economic prosperity, and now this is a recipe for a victory.
Thank you very, very much, Dr. Zom. I must say that your presentation was very eye-opening on a lot of perspectives, and we are very, very grateful that you were able to make the time to come here, and hopefully you'll be able to give us an update in the near or far future. And I will also want to say that next week we have Dr. Sergei Yakovchuk, who is professor of history and Slavic studies at the University of Victoria, who will be further exploring basically the raison d'etre of why Russia has attacked Ukraine. So, Susie, thank you very much for hosting, and have a very good week. Goodbye.
Thank you very much, and have a nice day, dear colleagues. Yeah, thank you.